Projected 35% increase in biosecurity investments in healthcare, pharmaceuticals, and global supply chains by Q1 2025. Implications for international collaboration and regulatory frameworks. Overview. As we look toward the first quarter of 2025, projections indicate a substantial 35% increase in biosecurity investments across healthcare, pharmaceuticals, and global supply chains. This anticipated surge in funding reflects a significant pivot in prioritizing safety and resilience in response to the vulnerabilities highlighted by recent global health crises, particularly the COVID-19 pandemic. This report analyzes the implications of this investment increase, emphasizing the need for international collaboration and the evolution of regulatory frameworks. Key highlights. 1. Increased investment and focus areas. The consensus across various sources is that a notable increase in biosecurity funding will enhance healthcare systems, improve pharmaceutical research, and secure global supply chains. The focus is on creating robust systems capable of mitigating risks associated with future pandemics and biological threats. Investments will likely target advanced research in vaccine development, therapeutic drugs, and the integration of biosecurity measures within existing healthcare infrastructures. 2. Use cases and economic data. Historical data from the COVID-19 pandemic illustrates the economic impacts of biosecurity breaches, revealing critical vulnerabilities in supply chains and healthcare systems. Reports highlight how the pandemic resulted in economic losses amounting to trillions globally. With the projected increase in biosecurity investments, stakeholders anticipate significant economic savings, potentially in the billions, through improved efficiencies and prevention strategies, ultimately reducing the financial burden of health crises. 3. International collaboration. A recurring theme is the essential role of international collaboration in confronting biosecurity challenges. The increase in funding is expected to foster partnerships among countries, corporations, and research institutions, facilitating the sharing of knowledge, resources, and technological advancements. Collaborative initiatives may include joint research projects, shared databases for tracking biological threats, and coordinated responses to emerging health crises, driving a unified global strategy in biosecurity. 4. Regulatory frameworks. The anticipated rise in investments will likely necessitate the development of new regulatory frameworks. Sources indicate that enhanced biosecurity measures will require stricter guidelines for pharmaceutical companies concerning the production and distribution of vaccines and therapeutics. Regulatory evolution may also encompass tighter controls over supply chain logistics, ensuring that vulnerable points are fortified against potential threats. This could involve international standards for biosecurity compliance that align across different jurisdictions. 5. Diverse perspectives on implementation. While there is a general agreement on the need for increased investment, perspectives vary regarding focus areas and implementation timelines. Some sources emphasize the role of technological advancements such as artificial intelligence and data analytics in driving biosecurity improvements, while others stress the importance of traditional supply chain management practices. Additionally, there are differing views on timelines. Some stakeholders advocate for immediate actions to commence in 2023, while others suggest a more gradual rollout leading up to 2025. Timeline of events. Pre-2020, investments in biosecurity were minimal, with little focus on global preparedness for pandemics. 2020, the COVID-19 pandemic exposed critical weaknesses in global health systems and supply chains, prompting a re-evaluation of biosecurity priorities. 2021 to 2022, initial discussions on increasing biosecurity investments began as stakeholders recognized the urgent need for improved systems. 2023, various governments and organizations initiated plans to boost biosecurity budgets, paving the way for the projected 35% increase by Q1 2025. Q1 2025, the anticipated surge in investment is expected to yield new technologies, enhanced international collaboration, and revamped regulatory frameworks. Conclusion. The projected 35% increase in biosecurity investments signifies a transformative moment in global health and safety. By addressing vulnerabilities exposed by recent crises, stakeholders are positioned to cultivate a more resilient future through collaboration and innovation in regulatory practices. The commitment to enhance biosecurity measures will not only safeguard public health but also bolster economic stability by preventing the extensive financial losses associated with health crises. As we approach Q1 2025, the focus will be on implementing these strategies effectively to achieve a unified and robust global response to biosecurity threats. Additional insights: technological advancements. The incorporation of advanced technologies including artificial intelligence and big data analytics will be crucial in predicting and preventing biosecurity threats. These technologies can enhance the ability to track disease outbreaks and optimize supply chain management. Public-private partnerships, strengthening collaborations between governments and private sectors will be essential for funding innovative research and accelerating the development of biosecurity solutions. Community engagement. Engaging local communities in biosecurity initiatives can enhance awareness and preparedness, ensuring that interventions are culturally sensitive and effective. This comprehensive approach to increasing biosecurity investments will redefine global health frameworks and ensure better preparedness for future challenges. The projected 35% increase in biosecurity investments by Q1 2025 reflects a significant shift in priorities across healthcare, pharmaceuticals, and global supply chains. This increase is primarily driven by lessons learned from recent health crises, particularly the COVID-19 pandemic, which exposed critical vulnerabilities in these sectors. Here are some counterintuitive insights derived from the content. 1. Investment in biosecurity versus immediate economic gains. While the increase in biosecurity investments is expected to save billions in potential future costs by preventing health crises, the immediate economic benefits may not be as clear-cut. Many industries may initially see these investments as a cost rather than a benefit. This counters the notion that all stakeholders will immediately recognize the value of biosecurity investments in terms of profit, as some may prioritize short-term gains over long-term safety. 2. Global supply chains and local economies. The focus on enhancing global supply chains may seem to suggest a move toward globalism, yet it can result in local economies becoming more vulnerable if they rely heavily on international partners for biosecurity measures. This contradicts the expectation that global collaboration will universally strengthen local economies. Instead, it may reinforce dependencies that could be detrimental during crises. 3. Technological investment versus traditional practices. There is a significant emphasis on integrating advanced technologies like AI and data analytics for biosecurity improvements. However, some sources also stress the importance of traditional supply chain management practices. This highlights a counterintuitive reality that high-tech solutions may not be the panacea for biosecurity challenges, and a hybrid approach that incorporates both modern technology and traditional methods may be necessary for effective resilience. 4. Regulatory frameworks and innovation stifling. While new regulatory frameworks are expected to emerge from increased biosecurity investments, there is a paradox that stricter regulations could stifle innovation in certain sectors. Companies may become risk-averse and slow to adopt new technologies if they fear regulatory repercussions, which can hinder the very advancements intended to enhance biosecurity. 5. International collaboration versus national sovereignty. The call for international collaboration in addressing biosecurity challenges may seem straightforward, but it can inadvertently lead to tensions regarding national sovereignty. Countries may be reluctant to share sensitive data or resources, fearing that it could compromise their own biosecurity. This raises the question of how to balance the need for collaboration with the inherent desire for national control over health and safety measures. 6. Timeline for implementation. The projected timeline for implementing these investments varies widely among stakeholders. While some anticipate immediate actions, others foresee a gradual rollout. This discrepancy presents a counterintuitive scenario where urgency is recognized yet the actual mobilization of resources may lag due to bureaucratic inertia or differing priorities, suggesting that even a clear need for biosecurity improvements does not guarantee swift action. 7. Public perception of biosecurity investments. There is often a disconnect between expert assessments of biosecurity needs and public perception. While experts advocate for increased investments based on past crises, the general public may not perceive biosecurity as a pressing issue until faced with an immediate threat. This counterintuitive gap can lead to challenges in securing public support for funding and policy changes. In summary, the projected increase in biosecurity investments presents numerous counterintuitive dynamics that stakeholders must navigate. The interplay between immediate costs and long-term benefits, the balance between global collaboration and national interests, and the tension between regulation and innovation all highlight the complexities involved in enhancing biosecurity in the post-pandemic world. Understanding these nuances is essential for effectively addressing future health threats and ensuring a resilient global infrastructure. The report on the projected 35% increase in biosecurity investments by Q1 2025 presents several important details that may be overlooked by many readers. Here are the critical points along with their significant implications. 1. Economic impacts of biosecurity breaches. Most discussions around biosecurity investments tend to focus on the allocation of funds and the expected outcomes. However, the report emphasizes the economic consequences of past biosecurity breaches, particularly referencing the COVID-19 pandemic. The economic fallout from such breaches can be staggering, leading to billions lost in productivity, healthcare costs, and supply chain disruptions. Understanding this economic context is crucial, as it underscores the necessity for robust biosecurity measures not merely as a health imperative but as an economic strategy. The significance lies in the transition from viewing biosecurity as an ancillary cost to recognizing it as an essential investment for economic stability. 2. Role of technology in biosecurity. While many might be aware that technological advancements will play a role in enhancing biosecurity, the specific mention of AI and data analytics as essential enablers is often overlooked. These technologies can revolutionize how data is collected, analyzed, and acted upon in real time during biosecurity threats. For instance, AI can predict outbreaks and assess risk levels, enabling quicker responses. The significance of this point is vast. It suggests that investments in biosecurity are not just about increasing funding but also about adopting innovative approaches that can lead to smarter, more effective responses to future threats. 3. International collaboration beyond traditional borders. The report highlights international collaboration, which is a well-trodden topic in discussions of global health security. However, the nuances of this collaboration, such as partnerships between private sectors, NGOs, and research institutions, might not receive the attention they deserve. This collaborative model can lead to shared best practices and resources that transcend national borders, enabling a unified approach to biosecurity. The significance of fostering these partnerships is profound, as it can create a more cohesive global strategy that leverages diverse expertise and capabilities. For a regulatory framework evolution, another aspect that might be overlooked is the anticipated evolution of regulatory frameworks in response to increased biosecurity investments. The report indicates that new regulations will be necessary, but it does not delve deeply into what these regulations might entail or how they will be enforced. The significance here is twofold. First, it suggests a shift in the regulatory landscape that could impose new compliance costs on companies, and second, it raises questions about the speed and adaptability of regulatory bodies in keeping pace with new technologies and threats. This evolution could lead to tensions between innovation and regulation, impacting how quickly new solutions can be brought to market. 5. Differing perspectives on implementation timelines. The report notes that while there is a consensus on the increase in investment, there are differing opinions on the timelines for implementation. Some sources project immediate actions while others see a gradual rollout. This divergence suggests a potential risk of misalignment among stakeholders, which could lead to fragmentation in efforts to enhance biosecurity. The significance of this point lies in the need for synchronized action. Without a coordinated approach, the effectiveness of investments could be diluted, and the intended benefits may not be fully realized. 6. Historical context and learning from past crises. The timeline of events presented in the report reveals a critical historical context that many might overlook. The shift in biosecurity focus post-COVID-19 is indicative of a broader trend in public health policy and economic strategy. Understanding the historical lessons learned from the pandemic and previous health crises can inform current practices and investment decisions. The significance of this context is that it emphasizes the importance of adaptability and learning in public health frameworks, which can enhance resilience against future threats. 7. Integration of traditional practices with new innovations. The report hints at a tension between traditional supply chain management practices and new technological innovations. While the focus is often on cutting-edge technologies, the continued importance of proven traditional practices should not be underestimated. The significance of this integration is that it can lead to a more holistic approach to biosecurity, combining the strengths of both traditional and modern methods to build a comprehensive system that is resilient and adaptable. In summary, while the projected increase in biosecurity investments is a significant development, the overlooked aspects — economic impacts, technology integration, international collaboration, regulatory evolution, implementation timelines, historical context, and the blending of traditional and innovative practices — carry profound implications. These factors not only shape the future of biosecurity but also influence the broader landscape of global health and economic stability. Recognizing and addressing these nuances can enhance the efficacy of investments and prepare stakeholders for the challenges ahead. 1. Increased investment in focus areas. The projected 35% increase in biosecurity investments across healthcare, pharmaceuticals, and global supply chains represents a critical shift in strategy, prioritizing safety and resilience. This investment is designed to strengthen healthcare systems, enhance pharmaceutical research, and secure supply chains against future biological threats. The emphasis on developing robust biosecurity systems is crucial for ensuring preparedness against future pandemics, which have historically exposed vulnerabilities in existing infrastructures. 2. International collaboration. The anticipated surge in biosecurity investments underlines the importance of international collaboration. This collaborative approach is essential for effectively tackling biosecurity challenges. Partnerships among countries, corporations, and research institutions will facilitate the sharing of knowledge, resources, and technologies necessary to develop a unified response to global health threats. Strengthening international ties and fostering collaborative frameworks will enhance the capacity to manage and mitigate risks associated with biological hazards. 3. Regulatory frameworks. The projected increase in investments is expected to lead to significant changes in regulatory frameworks governing biosecurity. New regulations will likely be established to ensure compliance with enhanced biosecurity measures, particularly in the pharmaceutical sector, regarding vaccine and therapeutic development and distribution. There will be a need for tighter controls on supply chain logistics to prevent breaches and maintain integrity. This evolution of regulatory frameworks is critical for establishing standards that promote safety and accountability in biosecurity practices. 4. Use cases and economic impact. The emphasis on specific use cases and data related to biosecurity breaches, such as those witnessed during the COVID-19 pandemic, highlights the economic implications of inadequate biosecurity measures. The investments are not only aimed at preventing health crises but also at generating economic benefits, potentially saving billions through improved efficiency and enhanced preparedness. By addressing the vulnerabilities that have been exposed, stakeholders can better position themselves to mitigate future risks and protect both public health and economic stability. 1. The 1918 influenza pandemic and its aftermath. The 1918 flu pandemic, also known as the Spanish flu, was one of the deadliest pandemics in history, infecting about one-third of the world's population and resulting in approximately 50 million deaths worldwide. The global response to the pandemic highlighted significant weaknesses in public health systems and biosecurity measures at the time. In the years following the pandemic, various nations recognized the need for improved healthcare infrastructure, enhanced disease surveillance, and international collaboration. This led to the establishment of regulatory frameworks and the creation of the World Health Organization (WHO) in 1948, which aimed to coordinate international public health efforts and improve global preparedness for future pandemics. 2. The SARS outbreak 2002-2003. The outbreak of severe acute respiratory syndrome SARS in 2002-2003 underscored the importance of biosecurity and international collaboration in addressing emerging infectious diseases. Originating in China, the virus spread to several countries, prompting a coordinated global response. The outbreak resulted in significant economic impacts, particularly in tourism and trade. In response, countries enhanced their public health systems, improved disease surveillance, and established rapid response frameworks for future outbreaks. The experience also led to the development of international health regulations, which emphasized the need for member states to report outbreaks and collaborate on containment strategies. 3. The Ebola virus outbreak 2014-2016. The West African Ebola outbreak, which began in Guinea and spread to neighboring countries, highlighted severe gaps in global health security and biosecurity measures. The international community's slow response exacerbated the crisis, resulting in over 11,000 deaths and significant social and economic disruptions. In the aftermath, there was a concerted effort to improve global health infrastructure and biosecurity investments. Organizations like the WHO and the Global Health Security Agenda (GHSA) were strengthened to foster international collaboration and enhance preparedness for future infectious disease outbreaks. The outbreak prompted nations to invest in better healthcare systems, improve disease surveillance, and create more robust regulatory frameworks to ensure faster and more coordinated responses to potential health threats. The projected 35% increase in biosecurity investments across healthcare, pharmaceuticals, and global supply chains by Q1 2025 represents a significant shift in priorities, driven by lessons learned from recent global health challenges, particularly the COVID-19 pandemic. This increase is expected to have far-reaching implications for international collaboration, regulatory frameworks, and technological advancements. Future outlook. 1. Enhanced healthcare systems. Investments will likely lead to the development of more resilient healthcare infrastructures capable of rapidly responding to biological threats. This could involve integrating advanced technologies such as telemedicine, AI-driven diagnostics, and real-time data monitoring systems, which will enhance the ability to detect and respond to potential outbreaks quickly. 2. Pharmaceutical innovation. The surge in funding is expected to accelerate pharmaceutical research and development, particularly in vaccine technology and therapeutics. Companies may focus on mRNA technology and other platforms that allow for rapid development and deployment against emerging pathogens. The increased collaboration between public and private sectors could lead to breakthroughs in drug discovery and production processes, ultimately reducing the time and cost associated with bringing new treatments to market. 3. Global supply chain resilience. Strengthening global supply chains will be a priority as investments target vulnerabilities exposed during the pandemic. This may involve diversifying sources of raw materials, increasing stockpiles of critical supplies, and adopting more sophisticated logistics solutions. Companies will likely invest in supply chain transparency and traceability technologies to mitigate risks and improve responsiveness during crises. For international collaboration, the anticipated investments will foster greater collaboration among nations, corporations, and research institutions. International partnerships will be crucial for sharing knowledge, resources, and best practices in biosecurity. This could lead to the establishment of global frameworks for public health preparedness, enabling countries to coordinate responses more effectively during health emergencies. 5. Evolving regulatory frameworks. As biosecurity investments increase, regulatory frameworks will need to adapt to ensure compliance with enhanced safety measures. Expect stricter guidelines regarding the development and distribution of pharmaceuticals as well as more rigorous oversight of supply chain practices. Regulatory bodies may also focus on harmonizing standards across countries to facilitate international trade while maintaining high safety protocols. 6. Technological integration. The role of advanced technologies in biosecurity will be paramount. AI and data analytics are predicted to revolutionize risk assessment and management in healthcare and supply chains. Predictive modeling could help organizations anticipate potential threats, while blockchain technology may enhance supply chain transparency and security. Investments in digital health technologies will likely enable better disease surveillance and patient management. 7. Public health education and awareness. A growing emphasis on biosecurity will also translate into increased public health education and awareness campaigns. Governments and organizations will likely prioritize educating the public about biological threats and the importance of vaccination and preventive measures. This cultural shift could lead to higher vaccination rates and better public compliance during health emergencies. 8. Economic implications. The financial benefits of increased biosecurity investment are expected to be substantial. By preventing future health crises and improving system efficiencies, stakeholders could save billions in healthcare costs, lost productivity, and economic disruptions. The return on investment will be closely monitored with an emphasis on demonstrating the value of biosecurity enhancements to policymakers and the public. Conclusion. In summary, the projected 35% increase in biosecurity investments by Q1 2025 is poised to transform the landscape of healthcare, pharmaceuticals, and global supply chains. By prioritizing resilience and collaboration, stakeholders can create systems that are better equipped to handle biological threats, ultimately leading to improved public health outcomes and economic stability. As industries adapt to these changes, the focus on innovation, regulation, and international cooperation will be critical in shaping a safer and more secure future.